Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Conversations around health are never complete without addressing the role of the mind, for it profoundly shapes how individuals experience and manage their conditions. While physical symptoms often draw the most attention, the emotional and psychological aspects carry equal weight and demand thoughtful consideration. This becomes especially important when we look at chronic health conditions, where the journey is long and layered. Today's discussion is significant because it allows us to highlight the unseen struggles, validate lived experiences, and foster a more compassionate understanding. By doing so, we move closer to holistic care that embraces both body and mind together. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we are here to discuss a very crucial subject: mental health challenges for people with type 1 diabetes. And to guide us through this important conversation, we have with us the distinguished health expert, Dr. Rahul Chandhok. Dr. Rahul Chandhok is a distinguished psychiatrist with over 27 years of experience in mental health and behavioral sciences. Sir is currently working as the head of psychiatry and senior consultant at Artemis Hospitals, Gurgaon. His expertise encompasses a wide array of psychiatric disorders, including schizophrenia, bipolar disorder, obsessive compulsive disorder, depression, anxiety, and substance abuse disorders. Throughout his illustrious career, Dr. Chandok has held pivotal roles at esteemed institutions such as AIIMS, Safdarjung Hospital, and VM Medical College in New Delhi. Sir earned his MBBS from MKCG Medical College, Behrampur, Odisha, in 1998, followed by an MD in Psychiatry from Baba Farid University of Health Sciences in 2002. In addition to his clinical practice, Dr. Chandok actively engages in community outreach, conducting continuing medical education or CME sessions, patient awareness programs across Delhi NCR. A former Paul Harris Fellow of the Rotary Club, Faridabad Central, Sir is also affiliated with the Indian Psychiatric Society. Sir's commitment to advancing mental health care and his compassionate approach have earned him recognition and respect among peers and patients alike. Sir's dedication continues to inspire and positively impact the field of psychiatry. Dr. Rahul Chandok, THIP Media welcomes you, sir.
Yes, thank you. Thank you for having me on the platform.
Thank you so much for your time today, sir. Sir, we all realize that, type 1 diabetes, it requires constant care. But beyond the physical aspects, lies an equally important dimension, and that is the mental health. And, many who are silently struggling with the emotional challenges, in their daily management, they're often left unspoken. So, to bridge this gap, and shed some light on the issue, I would like to begin with a very basic question here: that how does living with type 1 diabetes affect a person's mental and emotional well-being on a daily basis? And how would you say that this experience differs from the ones who are diagnosed with type 2 diabetes?
Okay, so you see, type 1 diabetes is usually diagnosed in children.
Okay.
So they start having with the rounds of hospitals or clinics pretty early in life. And by the time they realize that, yes, we have this condition, okay, and it's going to be there lifelong. So that becomes a very stressful part of their life.
Yes.
that
Yeah.
we have to give up so many things. We have to be under constant monitoring. There has to be uh, medication. Okay,
Yes.
so
Right.
that's the basic crux. And uh, you see, at various stages of life, a type 1 diabetes patient undergoes various forms of stress.
Yes.
Like
Ji.
when the person is a child, naturally there is apprehension in the minds of parents. They are going through their own issues, coming to
Ji.
terms with the diagnosis.
Ji. Ji.
Okay?
Ji.
So the child also faces the same things. Okay, there is
Yes.
always a doubt in the mind of the child that uh, whether something will happen to me or not, or how I'm going to cope with it.
Yes. Yes.
Okay.
Ji.
Then let's jump to the adulthood.
Yes.
In adulthood, in our society, the most basic thing in people's mind is whether I have to live alone for my life, or I can marry, or I can have a partner.
Yes.
That again becomes quite stressful.
Ji. Ji. Ji, sir.
Okay, what to disclose, what not to disclose. So this is the adulthood scenario. And then uh, as the life progresses, along with type 1, there occur complications of diabetes.
Yes.
Okay. So whether the impact has been metabolic, uh, like the person has thyroid now, or the person has hypertension now, or it has impacted other organs, or it has impacted the nerves or the blood vessels. So those are the challenges a senior person has to face. So at each stage of life, a person having a diagnosis of type 1 diabetes has to uh, not only face but overcome a lot of stress
Ji. Ji.
as compared to type 2 diabetes. Majority of the people are diagnosed in their adulthood,
Ji. Ji.
right? And
Ji.
yes, definitely it scares them also. But when you compare it to a type 1 diabetes patient, naturally there is a whole lot of difference.
Right. Right, sir.
The
Right.
apprehension is there in both the scenarios, but it is very, very high in type 1 diabetes.
Ji.
Okay.
Ji.
Because there is no turning back.
Yes. Yes.
Okay. In type 2, the person can work on it. The person can try the level best to reduce weight. Various other metabolic changes can be attempted. Okay. And they will have a bearing on it.
Yes. Right. Right, sir.
So that's how
And
the two things are different.
Ji, ji, sir. And like you just very beautifully mentioned that, a child has to live with a certain condition at two very different stages. That you've been diagnosed with something early, and then probably you have to carry it on to your adulthood. And that acceptance is a little difficult for them. Absolutely correct, sir. But then, sir, what are the most common psychological challenges that you have observed in some of your patients with type 1 diabetes?
So as the person grows older and realizes that this condition is going to be there,
Ji,
the injections, the monitoring is going to be there. And because of the condition, the person has to accept certain handicaps.
ji.
It becomes tougher. And a lot many times, not only people remain anxious, they go into depression also
Okay. Ji,
because they think that they cannot live a full life.
ji, ji,
Okay,
ji, sir.
so the whole gamut of symptoms of anxiety and depression are visible.
Ji,
They start having lack of interest in whatever they are trying to do, whether it is studies or they have a job.
ji.
So a lot many times we see cases with anxiety and depression.
Ji, sir. Ji, sir. And like you've been observing and diagnosing and even managing, a wide spectrum of psychiatric patients. So would you help us understand that how does this diabetes distress, it differs from general stress? And why is it important to recognize this diabetes or type 1 diabetes related stress early?
You see, when we talk about general stress, like uh, in childhood, we all have to face exams. There is always a peer pressure. There is always competition. But all those things are not permanent. We know that
Ji,
the
sir.
condition is permanent.
Ji, sir.
That's how it's different. The stress level is very different. If you
Hanji.
accept it, if you acknowledge it, and you start taking it in your stride, you start thinking about it as if you have a spectacle to wear.
Ji, ji, sir.
Okay, then you get accustomed to it. Then you start living with it
Ji,
in all its color.
ji, sir.
But uh, if you are not ready to accept the diagnosis, if you have a hitch with it, if you are not getting comfortable having this diagnosis, then there are a lot many issues. There are a lot many stressful things happening.
Ji, sir. Ji, ji. Okay. And now, sir, coming on to an age group which is already going through a lot of physical changes, any child would be reaching the teenage or the adolescent phase. So, sir, how do adolescents and, of course, the social pressures or stigma, shape the mental health experience of those who are struggling with type 1 diabetes?
So the impact on the teenagers is the maximum because you
Oh,
see, when the person is a child, naturally the person is under the care of parents or uh, there is a family to look after.
gee,
Okay, but uh, teenage is about all about individualism.
yes,
Okay, it's about uh, development of the personality.
gee,
And there, if a person thinks that, yes, I have a disability, then the confidence is gone. The confidence to face the world, the confidence to uh, do anything in the world is gone. So,
gee,
which has a great impact on it,
gee, gee,
on
sir.
the side.
Ji, ji. And now coming on to something that you actually help us understand is the fear of type 1 related complications, because the person who's been on medication for a very long time has to live with this fear also, sir. Apart from this also is the fact that sometimes if you miss a dose or there's an excessive intake or consumption of the dose, there can also be the excessive dosage related side effects. So, sir, in your experience, what would you say that would be the impact of the fear of hypoglycemia or diabetes related complications? The impact of these two consequences on the patient's mental state.
See, nowadays, we have sensors to continuously monitor blood sugar, but
Hanji,
uh, they are not accessible to everyone.
Hanji,
So there is always a dread of the sugar dropping.
Hanji,
Okay, and
Ji,
the dread can and of it definitely leads to panic attacks,
okay, Ji,
and it becomes very difficult to distinguish whether it is happening because of the fear of hypoglycemia or a hypoglycemia has happened. That's why the anxiety is there because the symptoms are similar.
Ji, Ji, sir,
Okay, so
Ji,
a lot many people when they have a lot of worry about their blood glucose level,
Ji.
they have anxiety and sometimes they do experience panic attacks.
Ji, ji, sir. Ji. And when would you suggest that someone who's been diagnosed with type 1 diabetes, seek help from a mental health professional like yourself? And how would you say that the therapy would benefit such patients, sir?
See, as soon as we find that the worry is having a bearing on your day-to-day life, when it is
जी
impacting that, a
जी
person should consult.
हाँ जी
Okay. So it's all about whether you are having an impact on your day-to-day life and to what extent you are not able to live normally.
जी जी सर
Okay. That because you see, worry is going to be there
हाँ जी
because the disease is like that. But you have to start acknowledging it, accepting it, and start living with it.
हाँ जी बिल्कुल
Right. So
right
when the worry becomes overwhelming, overpowering, and it starts impacting your day-to-day life, that is the
जी
time when you should get in touch with a mental health professional.
जी जी सर जी okay. And somebody who has contacted you, sir, apart from the regular therapeutic interventions that you would be prescribing your patients or you would be helping them get along with, are there any lifestyle approaches that you would suggest them that could help them improve their mental health outcomes?
So there are two things about it. One
जी
is prevention of a breakdown,
जी
and second, management of a breakdown.
okay जी
In one state, there is apprehension that a mental health breakdown might happen because
जी
the person is very apprehensive, the person is very worried.
जी
In the other case, the depression is already there.
okay right
Okay.
right sir
So, on one hand, we tell them that yes, you should do regular exercise, you should follow your doctor's prescription to the T, and uh, you should definitely practice yoga because
okay
such things are good for prevention.
right right
But if a breakdown has already happened, whether it is panic or it's depression, then you should reach out and take proper treatment.
okay
Because if a disturbance a breakdown has already happened,
जी सर
then the motivation to do exercise or yoga is not uh, there.
जी जी
And these are not treatments. These are
hmm.
very excellent for prevention, but
Yes,
they are not treatment.
yeah. They're
Okay.
better off as supportive measures, and but they
Yeah.
cannot replace a psychiatric intervention. Agreed, sir. And like sir, you just mentioned that these patients, usually diagnosed early, they're not very they're not they need their parents all the time. They're not financially independent patients. So
Hmm.
sir, as a mental health expert, what would you say that can family members and caregivers, better support the emotional needs of someone with type 1 diabetes?
See, first of all, whosoever is thinking of giving support to a patient, they
जी,
have to be mentally healthy themselves.
ओके, ठीक है,
Because a lot of parents, when they are told about the diagnosis, they
हाँ
become
जी,
very apprehensive. They have their own doubts. Uh, they can easily lose hope. They can become depressed. So
ओके,
before you think about giving support to someone, you must take care of your own mental health.
जी, जी,
Do
जी,
realize that yes, it can happen to anyone, and
जी,
help and support is possible. Treatments are possible.
जी,
So that's the first thing.
जी सर,
Okay.
जी सर,
Before we come to the patient, providing help to the patient, it is very important that they should look after themselves.
right, right. So you can be a support system only when you are ready and prepared to be that support system. Right,
Yes.
sir. Right.
Right.
Okay. And I think talking about self-acceptance that you've said that, it's sometimes very difficult for patient to take on their diagnosis well. I'm sure certain myths and misconceptions could be a contributor to these. So, sir, would you say that there are any myths around type 1 diabetes, such as blaming lifestyle choices or assuming, that it can be reversed? So, how do these misconceptions, in your experience, usually affect the patient's mental well-being?
So misconceptions, whether they are about diabetes or whether they are about something else, they
Ji,
are always harmful because when you are not sure about anything and you are just
ji,
relying on your own basket of information,
हाँ जी,
then there is very likely to that a mistake will happen.
हाँ जी, हाँ जी,
Okay.
right.
So it
जी,
is always better that you should talk to your doctor. Whatever your apprehensions are there, you should get them clarified by the doctor
जी, जी
and
sir.
follow the proper advice.
हाँ जी, हाँ जी sir. And now talking about the pressure that we usually get. अभी हमने बहुत सारे stages की बात की. We talked about adolescence. We talked about the working environment of somebody who's been growing up with the condition, sir. So, what role should schools and workplaces and even communities play in creating a more supportive environment for individuals who are battling type 1 diabetes?
See, we can divide the thing into two parts. Means
जी sir.
one is what steps can be taken by the schools, and the other is what steps can be taken by the workplaces. Because school deal with children, okay,
हाँ जी, हाँ जी,
workplaces are going to deal with adults,
हाँ
okay,
जी,
and so first thing is that everybody should be aware about type 1 diabetes and what is the need of the person.
जी,
Okay. And suppose the person is having difficulty of some sort, is not well, and
जी,
if you if you're just not able to realize what kind of trouble the person is in, you
जी,
sometimes are not empathetic enough with them,
yes, yeah,
which leads to further stress.
हाँ जी, जी sir,
Okay. And similarly is the case with the workplace.
जी,
People have to be aware that this can easily spiral into an emergency. Okay.
yes, yes,
So adequate safeguards should be there. So if you have such a person on your staff, you should be, if possible, having a blood sugar testing unit with you, okay? Or
जी,
at least you can have a drill where if you see that maybe sugar is becoming low of someone, you can
जी,
offer some sugar to that person.
जी, जी, जी,
Okay, the HR can take care of this in
जी,
their trainings or
हाँ जी,
when they interact with the employees.
हाँ जी, हाँ जी. So basically, preparation for certain emergencies. मतलब this is not a stigma or a taboo. I mean, type 1 diabetes is an autoimmune condition, so one should be ready.
Yes,
So one can prepare so that you can help someone diagnosed
yes.
with the condition, right, sir? And coming on to something which might help people, get aware or understand the condition better is health literacy, sir. So how important would you say is health literacy in helping people with type 1 diabetes understand their condition and reduce anxiety around its management?
You see, health literacy is like financial literacy,
Yes,
but having information uh, and being literate are two very different things. The point is, if you have information, but still, what changes does it bring to your behavior?
जी,
Okay. How
जी,
prepared are you to help someone or help yourself if you have such a condition?
जी सर,
Okay. That would come under health literacy.
जी सर.
Otherwise, we all have Google and we all have chatbots for all the information.
जी. We're all going through the WhatsApp university phase right now. All
Yeah.
of us are students. Ji, sir. Ji. And now I'm just going to summarize this wonderful session with one final question, sir. That could you share a comprehensive to-do list, practical steps, addressing both, let's say, medical and psychological aspects of, patients who are living with type 1 diabetes so that, we can safeguard their mental health in the long term.
So when summarizing the thing, I would like to say that recognition is the first step towards healing.
Ji.
If you recognize that you are having anxiety, if you recognize that, yes, you are having depression,
Ji.
that will lead to acceptance. And
Haan ji.
when you will have acceptance of it, you will seek out help.
Ji.
You will seek out remedy.
Haan ji. Ji, sir.
And uh, in today's world, definitely it is possible to help such people.
Ji.
The kind of
Ji.
medication which we have now, the kind of therapies which we have now, we can definitely help such people lead a fulsome life.
Ji, sir. Ji, sir.
Okay. So,
Right.
first thing is recognize it, accept it, and follow the therapy or the medication, whatever is being advised to
Ji,
you.
ji. So I think
Don't become your
self-acceptance.
own doctor.
Oh, yes. Absolutely. Right, sir. I think self-acceptance is the key here. The moment
Yes.
we do that, we adhere to the treatment modalities. Most certainly. How beautifully put, sir. So thank you so much for joining us today, sir. I really appreciate your presence with us today. And I'm hoping that the enlightening information shared will be valuable to many people who are combating type 1 diabetes. Thank you so much. It's really been a
Thank
pleasure.
you. Thank you for having me on your platform and
Thank you
giving
so
me
much.
this opportunity. Thank you. Bye bye.
Thank you, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.